Topic is perianal lesion. Dear students, we will discuss a common entity, similar entity rather, a perianal lesion. You know that common perianal lesion which you have to know, we come across in day-to-day surgical practice: piles, fissure, rectal prolapse, perianal abscess, carcinoma rectum or carcinoma anorectum. So the 5 conditions which you have to remember, because it very commonly we come across. So just go through this and see what this condition is. Look at that, the perianal region, very look like very proliferative lesion actually, and circumferential also. If you palpate, probably there is a hard indurated. Induration may extend also. So what are the different possibilities? Most probably it is a carcinoma anorectum or rectal carcinoma coming down, or anorectal carcinoma, or it may be rectal prolapse thrombosed with this one, but doesn't look like red color doesn't look like, or it may be prolapsed triangulated piles. That is also possibility. That's the second possibility. Third possibility, right, left. First thing is carcinoma anal canal or carcinoma anorectum, because fielding is important, examination inguinal lymph node is important, surrounding area is important. Digital rectal examination (PR) is very very important. Often by manual examination, one hand above, one below, one finger below, also important. Look for the liver, abdomen examination, and respiratory system and spine examination, systemic examination. Everything is important. Assessing this lesion, induration, extension, length, proximal, this one, everything is important. So most probably it is anal carcinoma, probably squamous cell, or anorectal carcinoma, probably adenocarcinoma. Rare malignancies or melanoma, other things are different, doesn't look like that. So here inguinal lymph node, both side examination, also external lymph nodes examination, the drainage area is in this area is important. Meantime, abdomen for liver, ascites, secondaries, liver secondaries, multiple secondaries in the liver, hard nodular secondaries, important. Free fluid may be there. If there is a peritoneal spread, that's also important. Systemic exam is also important. So biopsy is very easy to take in this patient. Definitely confirms what type of malignancy it is, and CT, chest and abdomen. PET CT may be useful as very useful here to stage the disease, whether it is systemic stage 4 disease or loco-regional disease stage 2, and accordingly plan the treatment, because it's a large one. Ideally, of course, CEA you have to do if it is rectal carcinoma, carcinoembryonic antigen, and maybe we have to do immunohistochemistry, tumor markers to finalize what type exactly it is. Then ideally treatment is initially neoadjuvant radiotherapy and chemotherapy, mainly radiotherapy, and of course after that abdominal peroral resection, inguinal lymph node dissection may be required, ileoinguinal dissection both sides. Then after that, of course, once you do the abdominal peroral resection, APR, other is called, you have to do a permanent end colostomy, usually sigmoid colon. So abdominal peroral resection, APR, permanent end colostomy. Then eventually continue the adjuvant therapy using chemotherapy. So neoadjuvant radiotherapy, then after that reassessment, abdominal peroral resection, then with the endostoma, permanent colostomy, then continuation of chemotherapy. If it is advanced, if there is obstruction, palliative diversion colostomy, then chemotherapy, and palliative symptomatic management, pain, nutrition, all those things are palliative management. So MRI pelvis is very very useful. CT abdomen is useful. They are complementary to each other. That is the point which you have to remember always. And the treatment I already told, ileoinguinal about adjuvant therapy and so on. So read my clinical methods in surgery and a manual of surgery, rectal chapter. It goes everything about these rectal prolapse, other canal carcinoma, rectal carcinoma, piles, everything. So go through that. My manual of surgery, clinical method, how to examine, also go through that. And students, again request you to subscribe my YouTube channel and share with your friends and colleagues and press the bell to upgrade your surgical knowledge about different instruments, specimens, images, X-rays, clinical cases, brief operative procedures, and also live session you join once in 2 weeks, where 1.5 hour discussion is there about every clinical condition like hernia, thyroid, breast mass, abdomen. There are other senior professors also join. So if you join live session, you get a certificate which will again very useful. Also have my manual of surgery and clinical methods in surgery for your upgrade your surgical knowledge. Again request, join my YouTube channel, subscribe it, share with your friends to understand surgery and learn surgery on day-to-day basis. So answer the MCQ, what this instrument is. A, B, C, D, find out the right answer. I appreciate your answer. Dillon's procedure is done for, again A, B, C, D, find out the right answer. I appreciate your answer. Quotation of the day is never stop dreaming. That is the beginning of future. If you dream, you'll be able to plan. If you don't dream, you can't plan. Dream is required to plan and implement. So that is why dreaming is important for any work. That is an important point, especially important in surgery. So students, I hope you understood this lecture very well. Students, see please go through, purchase my SRB's Manual of Surgery, current edition, which contains all surgical chapters with the quotations, with a lot of photos, illustrations, clinical approaches, principles, and treatment aspects. It covers general surgery, it covers endocrine surgery, thyroid, breast, peripheral disease, varicose vein, gastrosurgery, so everything is covered, and urology, neurosurgery, cardiothoracic surgery, instruments, anesthesia brief chapter, adjuvant therapy, everything covered as far as CBSE, as far as CBME syllabus. It is covered everything for students. There are quotations, illustrations, photos, briefly operative technique, and everything. Please purchase my manual. It is more than enough to understand surgery as such, and also purchase my clinical methods in surgery. Every examination is covered, general examination, like other examination which is important for students, hernia, hydrocele, immunoscleral swelling, breast lump, thyroid, abdomen mass, peripheral disease, varicose vein, all aspects, in detail examination method with the principles and lot of photos. It is under differentiated in the tabular form, but there are no management concept because it's only clinical book. And each chapter has got a video which shows how to examine this. For varicose vein, there is a video. QR code is there. You can always scan and go through that examination. Same thing for mass and other things also. Briefly, orthopedic also examination is there, and it also contains instruments, specimens, brief operative procedure also. It is very, very useful for students when they take the clinical examination. So how to examine a patient, it is very detailed, very, very useful, and rather best book for clinical methods, I could say. So please purchase my clinical methods in surgery, and also my new edition operative procedure, extensive voluminous book, in detail technique, every small procedure to major procedures, all covered, everything in detail, including GI, with the 2-volume book, more than 10,000 photos and illustrations, step-by-step explanations with the photos, illustrations. It's a very, very useful book for operative procedure, all consultant, also upcoming surgeons, postgraduates. You can go through this book and before doing the surgery, it will be very, very useful again. To students, especially postgraduates, please go through my current edition operative surgery, also SRB's operative surgery atlas and test, and my small atlas of tissue approximation is with the video of how to approximate the tissues. Very, very useful to learn the suturing technique. 100 pages brief book with the video also, how to suturing, different suturing, bowel, skin suturing, different types of sutures, laparoscope suturing also briefly mentioned. That very, very useful. So students, kindly purchase my book and go through that and enjoy the surgery as such. And also please again request subscribe my YouTube channel, share with your friends and colleagues, and press the bell. Students, I hope you understood this lecture very well. Thank you so much.